Hi, my name is Jennifer LeMay, and I'd like to present Star in Her Eye, information about raising a child with Wolf-Hirschhorn syndrome. Meet Fiona, a child diagnosed with Wolf-Hirschhorn syndrome at 3.5 months of age. Her mother, Heather, writes about their experiences with doctors, therapists, and the community in a blog titled Star in Her Eye. Fiona's story will highlight my presentation on Wolf-Hirschhorn syndrome.
I basically set out to have like a super pregnancy for the whole 9 months of we planned Fiona. We had her really quickly. I had taken all the vitamins you're supposed to take beforehand, and didn't just take prenatal vitamins. I took additional supplements that some natural doctor told me about, and so I was taking DHA for her brain, and I did a lot of things that when I look back fascinate me, to sort of make sure that she was going to be sort of this super child.
Despite doing everything in her power to support her child's growth and development in the womb, during her pregnancy, Heather was often told by doctors that her child was younger than she thought. Heather's due date kept getting pushed back because of the child's size. Tessa from the 1 in a Million Baby blog explains.
What neither Heather or the doctors knew at this stage was that Fiona wasn't small because the due date was wrong. She was small because she had 4P-, or Wolf-Hirschhorn syndrome. The major features of this condition include a characteristic facial appearance, delayed growth and development, intellectual disability, and seizures, but only her small size was apparent while in utero. While doctors continued to keep an eye on Heather and Fiona throughout the pregnancy, they were not concerned for either of them, and Heather was allowed to go into labour naturally.
Prenatal and postnatal growth delays are one of the significant early signs of Wolf-Hirschhorn syndrome, along with characteristic cranial features that are likened to Greek helmet facies. What is most concerning, though, is that as many as 1/3 of reported patients with Wolf-Hirschhorn syndrome die in the first 1 to 2 years of life. Heather describes her first moments after giving birth.
As soon as she came out, the midwife said, "What a little peanut," like that, and I thought, babies are tiny. All babies are tiny. Why are you saying that? But she seemed especially shocked by the size of my baby, and that was the moment when fear kind of entered the room.
What followed were days of doctors and nurses questioning, why is she so small?
I needed a lot of just gentleness, and this one pediatrician walked in and said, again, we don't know why your baby's so small. This was the last day we were in the hospital. And my husband and I at this point were like, we don't know either, just let us go home. And he said, well, it's either bad seed or bad soil, which in my sleep deprivation and breastfeeding despair, because Fiona wasn't latching, I realized meant that he was saying either I was bad or my child was bad. Either the soil that made her was bad or she was. It was heartbreaking.
Shortly after the disturbing episode with the pediatrician, the family was released from the hospital. Fiona was born at full gestation, weighing 4 pounds, 12 ounces. Almost 4 months later, Fiona had reached 7 pounds, and that was when they received the call. Fiona was diagnosed with Wolf-Hirschhorn syndrome. Heather describes that moment. In her words, something in me broke with that news, because what I had heard immediately was that my baby, my first child, my gargantuan love in a 7-pound package, was broken. That was not true, but that's what I heard, and it sent me straight into a chair where I cried immediately. The diagnosis of a rare and medical developmental condition causes many families to grieve. Heather described this moment with exquisite detail. I wept with the kind of panicked, this can't be real fear, the kind that happens only a few times in one's life, that grips you by your throat, that makes it so you think maybe you can't breathe. You probably know these kind of moments I'm talking about. The ground seems to break beneath you, and there's nothing to grasp onto, nothing to steady yourself in a life that is suddenly alien and upside down. And what is this? This death of your old way of being? The windows were black, the ground broke, the internet glowed with surreal bad news, and I was floating in darkness. The syndrome was named after Wolf and Hirschhorn, who found the 4P chromosome abnormality in the 1960s. It had an incidence rate of approximately 1 in 50,000 births, and approximately 2/3 of reported cases have been female. The diagnosis is determined after chromosome analysis is performed with particular attention to chromosome 4. Fluorescent in situ hybridization, or FISH, can be done to the 4P16.3 region of chromosome 4 to detect deletions. After an abundance of experience with doctors and nurses, a geneticist shared with Heather and her husband information about Wolf-Hirschhorn syndrome. The geneticist opened a binder, showed us a diagram of 26 chromosomes, all looking like overly Xerox copies of broken black ramen noodles. He pointed to number 4. Heather says he didn't tell us anything new, but he told us in a way that made me feel like this life of Fiona's was just fine as it was. Wolf-Hirschhorn syndrome is a condition caused by a missing part or deletion of the short arm of chromosome 4. Some patients who have Wolf-Hirschhorn syndrome may have a small deletion of 4p, while others might be missing up to half of 4p. For this reason, some individuals have a less severe case of Wolf-Hirschhorn syndrome than others do. What stood out to me about this experience were the words the geneticists used to describe the condition. As early intervention specialists, we need to be aware of the power behind the words we use with families, because words matter. Heather recounts conversations with friends where they refer to behavior as normal. She said, "I cringed at it, the word normal. Fiona's lot in life was not abnormal, just different." As a writer, Heather focuses on the importance of words. Heather states in her blog that the geneticists used words like genetic deletion, which was descriptive and accurate, rather than genetic defect, which was evaluative and crude. He used words like cognitive disability, which seemed surmountable and elicited compassion, rather than mentally retarded, which seemed to drop Fiona in a cardboard box, tape it up, and label it outcast in Sharpie marker. After that meeting, she said she became astutely aware of the language surrounding Fiona and the power that language had over anyone who used it and heard it, especially her. So following this encounter, Heather became an advocate for her child and others with special needs. A blog post she titled "The Partial Glossary of Words Not to Use with a New Mom of Special Needs Baby" is presented here. What is concerning is that much of my research on Wolf-Hirschhorn syndrome produced articles written by doctors who used the words here. And if you recall, Heather's experiences in the first week of Fiona's birth included "what a little peanut," and "it's either bad seed or bad soil." So please don't use words like defective, disorder, or retarded. There are alternatives. Here I would like to present the health and developmental challenges that individuals with Wolf-Hirschhorn syndrome may experience. I would like to state that I did my best to use strength-based language when translating any insensitive words used within the research articles I encountered. So challenges occur in areas of growth and feeding, development and behavior, neurologic, cardiovascular, genital, urinary tract, ears and hearing, eyes and optic nerves, dental, musculoskeletal, respiratory, immunologic, and dermatologic. Heather also noted that there were feeding difficulties, which is typical for children with Wolf-Hirschhorn syndrome. She said she wouldn't latch, and a big part of being a mother is feeling responsible for your child's growth. Batchel and colleagues identified principles for the use of assistive technology devices with children, many of which are illustrated in the next examples used by Fiona and her family. 1, her family was involved in selecting, developing, and implementing assistive technology devices with Fiona. 2, these devices were an integral part of Fiona's daily routines across settings. 3, it's seen as a tool to foster increased learning, functioning, and independence for Fiona. 4, providing appropriate assistive technology was done as early as possible in Fiona's life. And these principles emphasize the need for assistive technology to improve Fiona's independent functioning and AAC to support her communication. AAC is a form of assistive technology called augmentative and alternative communication. So many families benefit from assistive technology to support their child's functioning where there's a developmental delay. As seen here, Fiona benefits from the support of a bumbo floor seat as a positioning device to sit independently. Another type of AT is AAC, shown here. This high-tech voice output device allows her to touch a symbol on the tablet and it speaks aloud for her. This particular app has a 2-touch access to a vocabulary of 14,000 words. In a 2-part blog post, Heather shared about their family's experiences with the iPad loaded with the app Speak for Yourself. It's important to approach AAC as a team with a plan, and Heather describes some advice she received. Give it a year. It is important to allow the child and family time to learn and adapt to new AT. During this time, the team also used additional assistive technology techniques to aid in Fiona's use of communication device. Since isolating a finger to push buttons was difficult, Heather discussed using an includer to help Fiona be more successful in communicating with her device. Another adaptation is the addition of a key guard, which is attached to the screen of the device. Fiona pokes her thumb through the square holes to hit her target. Next, Heather discusses the use of adaptive equipment to aid mobility. An example of adaptive equipment to help a child walk could be something like this toy grocery cart. Fiona used something such as this, and then transitioned to the use of a walker or wheelchair, and I was touched when Heather described a milestone in their lives.
She just turned 4. It wasn't much past that birthday that the physical therapist actually exited our house with the walker in hand. And the therapist said, "This is a good day." She kind of looked around like, "Hey, this is a good day. Like, we're taking away these things. She doesn't need this anymore." So, yeah, she was 4, so she spent all of the second year of preschool walking around with her peers.
Batshaw and colleagues note that a posterior walker with wheels is preferable to a standard forward position walker without wheels for improvement in the quality and range of movement. For children's scoliosis, special seating cushions or custom-molded inserts for wheelchairs can offer the necessary support for the child. These suggestions can aid the mobility of children with limited walking skills. To conclude our look at assistive technology, we jump forward to the transition to kindergarten, which was a concerning time for Heather. However, these fears were alleviated on the first day of school. On day 1, Fiona's elementary school had an assembly where parents were invited. They listened as every school professional introduced themselves, and when it was Fiona's speech therapist's turn, she said hello in 3 ways. First with her mouth, second with American Sign Language, and third with the same app Fiona uses on her talker. She said she'd soon visit every classroom to explain these different modes of communication. Heather stated, in other words, on day 1, Fiona's school began teaching every kid in the building Fiona's language. This was a true welcome. This is a model of inclusion. If you'd like more information about Fiona and her family, please see the blog Star in Her Eye. And set a reminder for April 16th. April, the 4th month of the year, and the 16th letter of the alphabet is P. So on April 16th, it's Wolf-Hirschhorn Syndrome Awareness Day. Families wear jeans with a hole in them to signify rare genes in the Wolf-Hirschhorn syndrome deletion. I'd like to thank Heather. If you'd like more information, please see her TED Talk about what makes life good or bad, and it challenges us to stop fixating on solutions for whatever we deem not normal and instead take life as it comes. She also is releasing a memoir this year, available in July. I'd like to extend a huge debt of gratitude to Heather and Tessa, who allowed me the pictures and the audio to bring Wolf-Hirschhorn syndrome stories to life. Thank you.